You want to be like this guy? Lose all your bones? Just have lots of bone loss? Well, take prednisone and it can help you do that job. Prednisone steals bones. It causes bone loss. Bone loss leads to osteoporosis. This is a permanent, irreversible side effect of prednisone. And so the doctors who prescribe prednisone the most are feeling really bad about it, about basically giving you a poison that is going to give you osteoporosis. They know it's going to help your joints, maybe your fingers, so you can move better, but it's coming at a cost, and that cost is your bones, the integrity of your bones, the strength of your bones, the resiliency of your bones to be able to handle a simple cough or tripping and not breaking your hip, or just twisting your back and not hearing a crack of a broken vertebrae, or losing height, shrinking because your vertebrae, your spine is compressing upon itself and you're shorter. Both of my grandmothers, when they passed away, they were a lot shorter than me, even though one of them, when she was fully grown, was the same height as me. They both had osteoporosis. They had both shrunk in height. And so it runs in my family. This is something I'm worried about. Even if I'd never taken prednisone, I'd be concerned about osteoporosis. And so these doctors, the rheumatologists, they all got together and they said, what can we do for our patients who are taking this poison at our request, but we want to help their bones? So what do we do? So they outlined all of these steps you can take. And recently they did an update, and it was a really focused update of just basically the new drugs that they wanted to focus on. And they wanted to make sure that people were clear of what their options are when it comes to what medications are best to help with the osteoporosis. So this is what they said. They said, step one is you need to figure out what your risk is. And it's pretty hard to do without your doctor. So you and your doctor need to figure out what your risk is. And this risk is a special score called the FRAX, F-R-A-X. FRAX, like fracture, broken bone, FRAX score. And you can go to this calculator. I'll leave the link below. And you can type in all of these little pieces of information about you to find out what is your likely risk for breaking a bone, for needing a hip replacement. That's like basically the worst outcome, what your score is. Once you find out your score, it's either less than 10%, between 10 and 20%, or greater than 20%. And then that helps decide what treatment options are best for you. So if you are at high risk, which is over 20%, they recommend that you take a pill called an oral bisphosphonate. The most common ones include Fosamax. That's probably the most well-known medication that is in this class. Boniva is another option. And these medications help to kind of like freeze your bone in time so you can't lose any more bone. And that's helpful to prevent fractures, to prevent broken bones. It's not the best way to like build up bones. It's just saying no more breaking down. That's how it works. And so there are other things we could talk about in another video of how to actually build up your bones. But this is the best way to prevent the bone from breaking right away. And so this pill, you have to take it very carefully. Your body is terrible at absorbing it. Like if you are given 100, you only actually get 1 into your body. It's really terrible absorption. And so you have to be super careful of how you take it. So you'll get instructions from the pharmacy of how to take it, but the typical way is first thing in the morning, on an empty stomach with a tall glass of water, sitting upright for at least 30 minutes. If you can do all of those things, and it's usually an hour, not just 30 minutes, then hopefully you get the best absorption possible. Food just blocks it from being absorbed. If you eat, like, forget it. You might as well have just eaten sand for all the good it's going to do your bones. So you got to be super careful for how you take it. Now they have another option for moderate to high risk, and they say you can use oral, which is the pill, or IV. So that's like an injectable version. And what's nice about the injectable version is it can be just once a year. Hey, only having to go in once a year to deal with this? That's pretty awesome. Or there's other options like denosumab, which is Prolia, or these parathyroid hormone analog things that are sometimes injected once a day, once a week, once a month. There are other options, but the best at this point is the bisphosphonates. Those are the ones that work the very best. So what if you're not super high risk? Is there anything else you can do? And the thing that they recommend is lifestyle modifications. So number one, losing weight. Now that's pretty hard to do if you're on a glucocorticoid like prednisone. So if you can, eat the best diet you possibly can. Second, to get as much weight-bearing exercise, not as much, to get weight-bearing exercise. And that means to do things that impact your bone, because that helps to build it back up. And so that's walking, dancing, things that use gravity, basically. Those are really important to build your bones. Then the third thing I recommend is to quit smoking, because it can actually itself cause bone loss, and stop drinking alcohol. I know it's rough dealing with the side effects of prednisone, but stopping alcohol is important according to them. So if you can do those 4 lifestyle changes, that can help. And the next thing they recommend is calcium and vitamin D supplementation. So if you are taking prednisone more than 2.5 milligrams per day, they recommend everybody is taking calcium and vitamin D every day. And the tricky part about calcium is you can't take it all at once. You can't take all of your daily dose of calcium all at once, or you won't absorb it. You can only absorb 500 milligrams at a time. So you need to split it up into 2 or more doses per day, eating healthy foods that have calcium in them, along with supplementing. And so because of that, I invented Nutranize Zone, and it includes 2 times a day dosing. This is the one you take in the morning. This is the one you take at bedtime. That way you split it up so that you're getting the 2 doses per day, and your body can actually absorb it. Not only does it have calcium and vitamin D, but I went on further. It also has magnesium, vitamin K2, potassium, and other things that help support your bones while on prednisone. So just go to nutranize.com and get this supplement designed especially for people on prednisone. And calcium and vitamin D, along with weight-bearing exercise, has been shown to counteract osteoporosis. So go to nutranize.com today. Signing off as Dr. Megan, your prednisone pharmacist.